Namaskar. Let's talk about diabetes in this video. Almost 15 out of every 100 persons in India has got diabetes, a very common disease. So I'm sure you would like to know what's your risk of getting diabetes in your lifetime. Now, diabetes is also known as a disease of complications because it affects every organ in the body, right from the head to the tip of your toes. The important organs affected are the eyes, heart, brain, kidneys, and even feet or legs, for example, where you can get gangrene. So, knowing diabetes is very important. And to know your risk, we have got what is called as Indian Diabetes Risk Score. Every country has that, for example, United States of America, Australia, Canada, Saudi Arabia. Each country has its own risk score system for diabetes. Some countries use, for example, was a woman having diabetes during pregnancy? Some countries use hypertension. For India, we have only four parameters to know your risk of diabetes. These four parameters are age, waist circumference, physical activity, and family history. Fortunately, type 2 diabetes is reversible by lifestyle or postponable. Even if you get diabetes, it is reversible in a way within 5 years if you get that. Otherwise, by good lifestyle, you can prevent diabetes to a great extent, for which you need to know what's your risk of diabetes. Now, let us go through the parameters: age, waist circumference, physical activity, and family history. Each one has again certain classification. For example, age less than 35, the score is 0. 35 to 49, the score is 20. And more than 50 years, the score is 30. And regarding waist circumference also, for men, it is less than 90 centimeters, and a waist circumference for women should be less than 80 centimeter, which is normal. If woman or man has got a more than 80 centimeters, say for example less than 100, then the score is 10. Or if it is pretty big waist, then it's around 20 point. It's easy to measure waist. What you need is just a measuring tape. You need to just find out a spot just above your bone here and the lower rib cage, and around which comes to a navel level. You keep one spot of the tape, go around your waist, bring it here, and in a relaxed position, see the reading. That is waist circumference. Let us take an example how to calculate your own risk score for type 2 diabetes. 98% of Indians have type 2 diabetes, whereas only around 1 to 2% are insulin dependent diabetics. Let's come back to the score system. Age. Let's take, for example, we have a Shankar who is working as a manager in a bank. He is around 40 years of age. His score is 20. Waist circumference is 95, which is more. The score is 10. Let us come to physical activity. Again, somebody who is working in fields, somebody who is going to gym regularly, his score system is 0 because he is active. Somebody who comes back from the office, watches his television for 6 hours, never goes out, his risk, where there is no activity, a sedentary lifestyle, the score is 30. And the same for family history. If one parent is diabetic, the score is 10, and both parents are diabetic, the score is 20. Minimum score is 0 and a maximum score is 100. When you score less than 30, your risk of diabetes is low. When you score between 30 and 59, your risk is intermediate. And when you score more than 60, your risk of getting diabetes is high. But this score system we have for Indians is accurate around 65 to 70%. But nevertheless, wherever you are, it potentiates you to do a good lifestyle modification. So let's go back to Shankar, who is around 40 years, and his score there is 20. Waist circumference is 95, which is more. There the score is 10. Physical activity, he doesn't do any physical activity. He's sedentary, goes to 30. And regarding family history, let us say one of his parents, say mother has got diabetes. So that score is 10. So let us join all of them. Age 20, waist circumference 10, that comes to 30. Physical activity, no physical activity is 30, 60, and family history, one patient score is 10, total score is 70. More than 60 is higher risk. So this person has an extreme high risk of getting diabetes. But with a good lifestyle, you can prevent diabetes, or, bit unlucky, you can postpone diabetes. Even if gets a diabetic, for example, it can be reversed within usually 5 years of getting diabetes by an excellent lifestyle which is continuously followed. So all these tables are given in my video. So please go through the table very carefully. I am Dr. Sattur. You are on video of Dr. GB Sattur and the lifestyle. Thank you for watching this video, and please subscribe. Thank you very much.